you for coming back and braving the weather. When I got here, it was a little bit lighter rain, so hopefully it wasn't too bad for you guys to get here. For those that don't know me, I'm Jill Davis, health educator with Humana, and I brought a couple of special team members with me today. We have Denny, who is our community liaison. He's the one that keeps me in line, at least tries to. It's very hard. Yep. And then we have Daryl in the back who flew here from Kentucky to kind of get an idea of what we're doing. He's our regional director, so we're so we're happy to have him here. And today we're going to talk about heart health. Before I start, I want to let you know, you probably already know this, but you do not have to be Humana members to participate in any of these community classes. We're here to try to keep the surrounding areas as healthy as possible. And as you know, that does not just mean going to the doctor and getting your medication and taking it as prescribed, right? There's a whole lot of other things we can be doing. And I know a few of you were here with my last talk on, what did we do, Mind diet or Mediterranean? Mediterranean diet. And there were some really good questions and sharing of stories that show me a lot of you are already taking the initiative to take better care of your health. So I'm really glad you're all here today. Before I start the actual presentation, and Denny's sitting right in line with my USB connection. See if it goes that far. Does it? Hold on, let me see if it's on the right side. Huh. It was just working. Let me turn it off and on again. Would you want to advance my slides for me? Oh. Yes. Might need to maybe try escape. So while he's working on that, I want you all to know I am not clinical. I do have a background as a personal trainer. I did go to grad school. I do know lifestyle medicine. I am not clinical. So if any of you have questions about medications or your own particular medical situation, that's why we passed out pens, just in case you want to write down a question for your doctor. Also, if you feel inspired by this presentation and anybody wants to start making lifestyle changes, make sure you let your doctor know first, especially if you have a medical condition or you take a certain type of medication. Let's say you have high blood pressure, right? And you go to the doctor's office and they give you a prescription for blood pressure medicine. Then 2 months later, you start a new exercise program, you cut salt out, you start eating healthier. What tends to happen to your blood pressure? Starts to control itself naturally, right? Oh, of course, thank you. What would I do without these guys? So if you're still taking that original medication, though, that you started before you started your exercise program, you're going to get blood pressure drops. So that's why, even though it's a great idea to make those lifestyle changes, always let your doctor know ahead of time so they can kind of stay on top of your numbers and make sure they adjust your medication as needed. All right, so we're going to go ahead and get started with we're not going to give you the answer yet. We're going to do a true or false quiz and see how much you already know. Just based on the fact that I've taught this class about 15 times so far, you're probably going to score a perfect 100 on this, but let's do it anyway. So first question, the only way to treat heart disease is by taking medications or having surgeries. Is that true or false? Why do you think it's false? That's right. Like what? Awesome. That's correct. So some sometimes you do need to take medications. Sometimes you do need to have surgery. But we have a lot of control also in managing heart disease. So it is not just medications and surgery. Good job. 1 for 1. Next question. Angioplasty and stenting or bypass surgery will fix your heart. True or false? Why not? Oh, you were cheating. That's true too. Yes. And I should have announced before I even started, do not look at your handout for the answers. Yes, that's actually, you're right. It's false. Those things can actually keep pain away. They can keep you from dying for sure. They can do things to unclog arteries and keep your heart going, but they're not going to fix the initial problem. And a lot of times they're just temporary, right? They don't always last. Good job. I told you you're going to do well. Last one. I know when I'm having a heart attack because I'll have chest pain. True or false? Why is that false? Right? Say that again? Because that's right. That's right. Do men and women have the same symptoms usually? No. Okay. Sounds like you guys did score 100. You're right. We're going to go over this a little bit later as far as symptoms go, but they are not always the classic symptoms like you see on TV where somebody just clutches their chest dramatically and falls to the floor, right? Heart attacks come on in very different ways, and we're going to cover that today too. So lots of important information we're going to go over today. All right, so first we're going to start with the 3 types of blood vessels, just so you know what they all do. There's arteries, veins, and capillaries. And I'm not going to bore you too much with what's going on over here because you're going to be asleep by the time I finish, and I don't want to do that. But if you just take a look at this picture, you can pretty much see everything that's going on. And if one little thing were to go wrong in there, that could mess up the whole system, right? And then you have the 3 types of blood vessels, taking blood in, taking blood out, bringing the nutrients to your organs, your brain, bringing oxygen to your organs and brain. And if those don't work correctly and your brain and organs don't get what they need, that could be another problem, right? So just so you know the differences between arteries, veins, and capillaries, they all do something different. An artery carries oxygenated blood away from your heart so it can deliver that oxygen and nutrients. The veins carry the deoxygenated blood back so that it can go through the lungs and get oxygenated again. And capillaries, you can even see some of them if you were to look at your wrist, are the tiny little branch-like veins that kind of cover everything, connect everything like branches of a tree. So that's all we have is 3 different types of blood vessels. But they all need to do their jobs and work correctly, right? Because if one doesn't, that could be a problem. All right, so now that we've talked about that long enough, we'll get into my more favorite part to talk about is blood flow. So these are pictures of your blood vessels. And you can see on the left side, the blood is going through nice and quickly, no problems whatsoever. It's kind of hard to see maybe from where you are, but there's a little bit of plaque starting to form on the sides there, and you can see it start to narrow a little bit. And then on the third picture, there's a lot more plaque forming where it's just a little bit of a narrow way for the blood to get through, but it's still coming through. And then all the way over on the right is when we have that problem, right? And I brought this, it's way too small, but I'm hoping you guys can see it. This is a normal blood vessel. This is pretty much right in the middle, and then this one is the one all the way at the end. I wanted to demonstrate the blood flow. So you guys can kind of see the speed difference. So this is the normal one, no plaque whatsoever. Just a little bit of plaque starting to narrow that situation. This one has already made it to its destination. This one's not even half through. So that's just kind of a visual of what happens when that artery or that blood vessel gets clogged up, right? Could this be a problem? Yeah, absolutely. So we had a couple stories that were shared before class, just kind of talking to everybody, and there's a couple people in here that have experienced that complete blockage and gone through some of the procedures we're going to talk about today. So I'm glad you're all here. Your handouts will have pretty much all the information that I discussed, but again, if you feel like you want to write questions down for your doctor or there's anything not in your handouts you want to remember, feel free to take notes, okay? Before we get into the types of cholesterol, just a quick show of hands, because I personally like to know, how many of you have had conversations with your doctor about what the different breakdown is of your specific cholesterol numbers and what they mean? So a handful. So they've explained what makes your total cholesterol number. Awesome. Where your individual triglycerides, LDL, and your HDL need to be. Awesome. Do not give those doctors up because that is awesome. Okay, so here's the cholesterol numbers. So LDL is the most common type of cholesterol to cause heart disease. So you can think of the L as lousy, okay? So just so you can memorize that that's the bad cholesterol. HDL is the happy or healthy cholesterol. So you can think of that for the H. The HDL's job is to go through the bloodstream and collect bad cholesterol and send it back to the liver for processing. So the HDL is our friend, and we want that one to be high, okay? Triglycerides are not exactly cholesterol, it's more fat in the blood, but that's another one that we want to get down. So I'm going to tell you a quick story on why it's important to understand your cholesterol numbers. So when I moved here 20 years ago, I had to find a new doctor, right? And I have family history of cholesterol, high cholesterol on both sides of the family, okay? In fact, I'm the only one in my family, like my immediate family and extended family, that's not taking a statin. So that gives you an idea. And my doctor looked at my total cholesterol, and he's like, I think you're going to need to take a statin. So I was like, can I see the numbers? This is when he really started to love me as a patient, right? And I looked, and I said, I don't need a statin. Look at the breakdown. So he takes it, and he looks at it, and he's like, you're right, you don't need a statin. You know why I didn't? Any guesses why my total was over the number that he wanted it to be? Why would I have not needed to take a statin? That's exactly right. My HDL was in the low 90s. So it was super high. So that makes part of the total, right? So who that has talked to their doctor about their cholesterol can tell me how they get that total? How does that total number get added up? Want me to tell you? Okay. Yeah, let's go to the next screen so you can see numbers, then we'll come back to the other one. So this is what doctors look for. They want it to be below 200 for your total, right? Your LDL cholesterol, they want, which is lousy, right? They want that to be below 100. And then your HDL, they want it to be 60 or above. So the total is found by adding the LDL plus the HDL plus 10% of the triglyceride number. So let's say your triglyceride's 100. They're going to add the 10 plus your HDL plus your LDL. That's how you find the total. So In that case, if you're one of those people whose doctors just send back everything as normal and they don't go through your numbers, this is how you understand the breakdown, right? So you don't just look at your total. You want to know your individual numbers and where those are, because that's more important than that total number at the top. Does that make sense? Awesome. Yeah, absolutely. I'm 220. Yeah. As long as your LDL and your triglycerides are within range, if your HDL is 60 or above, you're looking really good. And I'm guessing since you exercise regularly, your HDL is above 60. But yeah, that's exactly right. The HDL is what's going to make a difference. So if your HDL is too low, like say it's like 30, and your total is still above 200, well, then it's usually the LDL and triglycerides making it a little higher. Exercise is a big one. Absolutely. Yeah. Cardiovascular. And speaking of exercise, do you guys know how many minutes per week are recommended to do moderate intensity exercise for good health? Who said that? Good job. That's right. 150 minutes a week of moderate intensity is what's recommended for overall good health. And do you guys know what moderate intensity means? We're going to get to this stuff a little later, but while we're on it. Yeah. So moderate intensity feels like you could have a conversation. You're still out of breath, right? But you can't sing if you tried. So that's high enough that you're out of breath and can't sing, but you can still talk a little. You shouldn't be gasping for breath. That's high intensity, right? You can break it up however you want to. As long as you get 150 a week, they're even saying even 15-minute bouts do make a difference. Even if you just do 10 minutes, it makes a difference. No, no, it needs to be moderate intensity. Yeah. High intensity is a whole other ball game. And if somebody were to do high intensity, they'd be more gasping for air, and you only need to do 75 minutes a week if you're doing that intensity, right? And some people are who are 65 and up, just so you know. It's just that you don't want to go from the couch to doing high intensity. That's not recommended. So regardless, if you're new to exercise or you want to change your exercise plan, you definitely want to let your doctor know every time, okay? Any other questions before we go on past cholesterol? Okay, I wanted to make sure you guys were good with that because that's a very important part of managing heart disease risk. All right, we're going to go back to how heart disease can be diagnosed. We had somebody, I taught this class, what's today? Wednesday? I taught this class this week, Monday. And somebody was asking if I want to, check my heart and see what kind of condition it's in, what kind of test can I ask for? Usually doctors are going to put you through one of these tests unless there's symptoms or they suspect something. But you can always still have a conversation with your doctor about these steps. Best way to prevent is just to monitor numbers like your ABCs, right? Anyone know what the ABCs stand for? Okay, well, I'm going to tell you. So A is A1C. So like if you happen to be insulin resistant or have diabetes, you want to know where your blood sugar levels are. Guess what B is when it comes to heart disease? Just take a stab in the dark. That's right, blood pressure. And what would C be? We just talked about it. Cholesterol, that's right. And I always add D on because vitamin D3 is also important. So if your doctor does not test your D3 levels, ask them to, because most people are deficient in vitamin D, and most doctors don't automatically check it. So you tend to have to ask. Not everybody has to ask, but I would highly recommend asking, because if that number is super low, that can cause a lot of issues, and long-term can cause heart issues too. So some A, B, C, Ds, okay? Easy way to remember that. So if you do happen to start having symptoms, there's a few different tests that your doctor can do. Electrocardiogram is probably the least invasive. You guys have probably heard of EKG. It's the little needle that kind of goes up and down and tells you what your heart rate is doing, if your rhythms are regular, if you're skipping a beat. It can tell all of those things. That's basic, just sound technology, just measuring the electricity of your heart. Then you have an echocardiogram. That's going to use sound waves, and it actually creates an image of your heart so you can get an idea of what it's doing and what might be malfunctioning. Then we get a little bit more invasive as we go down the list. Catheterization, you guys have probably heard of before. That's when they send the dye through your vein and they send a tube in there and they kind of watch it on a screen, see if there's any blockages or anything like that. And then the heart CT or MRI is the most complete image of the heart. So that's where they can really see if there's damage after a heart attack or what blood vessels might need to be repaired. So that's just a really detailed image. So you've probably heard of all of these before, I'm guessing. But just so you have an idea of the breakdown. And these are actually all in your handout too, so that you don't feel like you have to try to memorize everything. Any questions on this stuff? Okay. All right, so then we talk about risk factors. So you can see there's 3 that we can't control, right? Age is 1. We can't control how old we are number-wise, right? But I bet everybody in here knows somebody who's 60 years old who acts like they're 80, right? And then you know somebody who's 80 that acts like they're 60. You notice that? I'm finding as I get older, and I know you're going to laugh at me, but I feel like I can tell the people that take care of themselves and the people that don't as we get older. You can usually tell by the way people move, right? So this age thing, this is just chronological, right? You can basically change your biological age, right? You can be younger inside if you care for yourself properly. You can also be older inside if you don't care for yourself properly, right? So it's not controllable as far as chronological age, but it is in terms of how we age inside actually, right? Gender, can't really control. Men tend to have more cardiac events than women, unfortunately. There's just a few men in here. And then family history, definitely can't control. So like my family history on both sides is absolutely horrible for heart disease. My dad's parents died in the early 70s. My mom's side had heart issues. So I know for a fact that's something I really have to look out for. So all genetics tells you is not this is going to happen to you, but this is what you need to look out for, right? So you think of genetics is the gun, and your lifestyle decides whether or not you pull the trigger. Really. We have a lot of control. Maybe not in every case, right? There's always going to be exceptions, but there's always ways to lower risk, which is the bottom 6, right? High cholesterol, we can absolutely control. Can anyone tell me the best way to lower your triglycerides? That's great for overall cholesterol, but specifically, what can you do just to lower the triglyceride number? That's good in general, too. Any other guesses? Yeah. White stuff, not snow. Sugar and white flour. If you in here decide you want to get rid of added sugars and white flour, which is basically like all the processed stuff, I guarantee your triglycerides will go down. If they don't, make sure you call me. You'll be the first one in 30 years that didn't work for. So if you're looking to make those go down, try that and it will work. LDL is the harder one, especially if you have the family history. But yes, all the things you guys mentioned, the cold cuts, the saturated fat, those things can definitely bring the LDL down. Higher fiber helps a lot. So the more fiber you can take in, the better. And then for the HDL to come up, of course, exercise is a really good one to bring that up. Good job. You guys know a lot of stuff. So smoking, I think we all know that. That's not good for your heart, right? Obesity puts more weight, puts more effort into what the heart has to do. That's never good. Inactivity. Have you guys heard that sitting is the new smoking? You guys heard that? All that means is that the mortality rate is just as high for sedentary people, meaning people who sit all day, as it is for people who smoke. Isn't that crazy? So if you sit most of the day, your risk is just, and I see people tapping each other, your risk is just as high of having a heart issue as smoking is. That's pretty powerful if you think about it. And when I talk about physical activity, people seem to freak out. Like you hear the word exercise, like, ooh, I don't want to do that, right? Like you don't have to go to the gym and wear spandex and sweat and be all, gung-ho. All it is moving more, right? Throughout the day, it's just moving more. So just getting up maybe every hour or so and just moving your body. That's all it is. So you always hear eat less, move more. I like to say eat better, move more. If you do that one phrase every day consistently, you will see change, not only in blood work, but mental health, the way you feel physically, your body will change, your blood work will get better, eat better, move more. That doesn't sound so hard, right? But then when I say exercise, nobody feels good with that word, so we'll try to keep that out. And then you can manage your high blood pressure, right? We talked about that. And diabetes is also manageable. So we have 6 controllable risk factors and only 3 that we can't control. So there's a lot of stuff we can do, right? So we kind of talked about this stuff already. I won't spend too long. You guys knew how many minutes per week that you need to be physically active. Healthy weight is also important. I mean, easier said than done. But if you do that phrase, you're going to do all 3 of those pretty easily, right? A lot of people think it's harder than it actually is. Okay, so we're going to spend a little bit of time talking about medications. I'm not going to spend too long here because that's more up to your doctor, but just so you can kind of see the most commonly used medications here. So there's a good chance that if you have a heart issue, you might be on different types of medications, maybe not just one, right? But as a health educator, oftentimes members will bring their medication list to me sometimes, and they don't even know what it's for. Like they don't know what they're taking and what it's for specifically. So sometimes they'll bring me their list just to tell them what they're taking it for. Other times they'll bring me their list so I can look up side effects or, just about the medication in general. So if you guys ever run into a situation where you're prescribed a new medication, feel free to ask your doctor about it, right? Why am I taking this? What side effects might I expect? How long do I need to take this? How long until the side effects might go away, because sometimes there's an adjustment period. Don't worry about asking your doctor questions, because sometimes they're busy, they see so many patients, they don't always have the time, right? So take their time and ask them questions, because this is definitely your life. You've got to go home and live, right? So it's important. Okay, so ACE inhibitors and beta blockers lower blood pressure, and they decrease the pressure in the blood vessel. And a lot of times these are even prescribed for people who have like anxiety or even like panic attacks because it keeps their heart rates low. So if you're somebody that takes a beta blocker and you're trying to figure out what your heart rate is when you're exercising, chances are it's not going to come up very high and you'll just have to go by how you feel. So keep that in mind too. Calcium channel blockers, they allow the blood vessels to relax and they also reduce blood pressure. And then medications to control blood sugar might be used just in case somebody has an uncontrolled blood sugar, right? Because people with diabetes are at a higher risk of heart disease. So the doctors want to make sure that's definitely under control. And then nitrates, you might see, like if somebody has a history of heart issues, they'll carry the little nitrate tube with them. It's like a little glass jar, and that just helps relieve chest pain if they happen to have chest pain. Statins, I think everybody in this room has heard that term. Those are usually prescribed for the high cholesterol, right? But again, you know, there is a way to control the high cholesterol naturally. So a lot of people don't end up having to stay on statins long term unless they have a heart issue or something the doctor wants to prevent any other events from happening. Any questions about any of those medicines before we move on? I know statin's kind of a hot topic. That is used to get rid of fluid. Depends. Sometimes it can be kidney failure. Sometimes it can just be fluid retention in general. Depends on the patient. But yeah, most often it's like congestive heart failure is what it's prescribed for. Yeah, just to get rid of the fluid. She wanted to know what Lasix was for. Fluid retention. Yeah. Okay. So these are the procedures you've probably, I'm sure we all have friends or family members that have had at least one of these done, right? Angioplasty is where they send a tube in with a deflated balloon into whatever artery is mostly blocked up with the plaque, and then they inflate the balloon and it just kind of presses the plaque against the wall so that the blood can flow again. More or less a temporary solution, but it keeps it open so you don't have to have any type of major surgery, right? Then you have plaque removal, which sounds really fun. This is where they use that laser. They can vaporize or cut out the plaque from the artery. Stent is the mesh tube that goes in. That stays there. That's a permanent solution, not temporary. So that's just designed to hold that artery open so the blood can flow through it. Then you have coronary bypass surgery, and that's when whatever it is that's clogged leading to the heart, they just literally bypass it and give the blood another route to get the heart blood in or out, depending on what's clogged. So you guys have probably heard of triple bypass, quadruple bypass. So that just means how many of those arteries were clogged that we had to find ways around. And then cardiac rehab. How many are familiar with cardiac rehab and what it is? Okay, good. So cardiac rehab is usually prescribed to somebody that's had some kind of a heart event or maybe even a stroke or just has a heart condition, where they go for 36 sessions, usually twice a week, and they go to a gym, more or less, and they're monitored doing their cardio workouts. And they get their blood pressure monitored, they get their heart rate monitored, their oxygen. It's overseen by an MD. There's usually a nurse in there, exercise physiologists who are clinical. You guys have heard of ARMC, right? Alamance Regional, close by. I used to work in the medical fitness center there when I worked at Cone, and we would get the people that graduated from cardiac rehab. So we would take them from that program and just work on their overall strength, keep their blood pressure monitored, all that good stuff. And the ones coming out of there always ended up better than, of course, before they went in. But the ones that continued with their exercise, they really thrived. And we were able to monitor them through that. So It's a really, really good program if you ever have a family member that needs to go through that. So we talked about the ABCs. Do you guys remember what the ABCs stood for? That's pretty much summing this slide up. What was A in ABCs? And we'll add the D, ABCD. What was the A? See if you guys were paying attention. Blood sugar, A1C. And you probably wouldn't even hear the term A1C unless you had like a suspicion for diabetes or pre-diabetes. So that one, it's understandable if you didn't just come up with that one. What about the B in ABCs? That's right, C and D. That's right. Does anyone know where your vitamin D level should be for optimal health? Has anyone been told their vitamin D level was low? I have. Only one in your blood. It's like hydroxy something D3 is how it would show up on your blood work. Yeah, and if it's below 29, that's considered low. But sometimes doctors will say, even if it's just like 30, they'll say it's normal. But ideally, you want that number 50 to 70 for optimal health. But it's very important not to just go get D3 supplements and start taking them because that can become toxic in your system. So you have to have your doctor monitor that because if that gets up close to 100, that's more of a toxic level. So that's why you never want to take a D supplement without getting your blood work monitored. Okay, so talk to your doctor about that one. Very important. Go ahead. Yes. Awesome. Awesome. That's great. Yeah, good. That's so important. Yeah. There's a lot of people I run into that just take D and they have no idea what their blood levels are, so it's really important. I'm glad you're doing that. Go ahead. Mm, yeah, that's a good question. First, you definitely need to talk to your doctor about when to take what because a lot of times medications do interfere with supplements and vice versa. They can affect, the effectiveness of either. So if you guys do end up taking supplements of some kind, make sure either your doctor or a trusted pharmacist or a trusted dietitian, make sure they know every little thing you're taking because chances are they can definitely affect each other. So I'm glad you brought that up because sometimes people think, oh, my doctor just needs my medication list and that's it. But no, they need your supplement list too, and they need it to be updated. And if your doctor doesn't know supplements, you can always talk to the pharmacist and say, hey, should I take any of these separately? Will anything affect my medication or vice versa? Because you also don't want to be wasting money on supplements if your medication is canceling out the effect, right? But absorption can definitely change when you mix the two, or even mix medications, right? That's what pharmacists are for. Was there a question in the back? No? Okay. Any more questions on what we've just been talking about as far as keeping all the numbers in check and knowing what they are, understanding them? Or if you've heard something on the internet or on TV and you want to know if it's factual or not, you probably know, don't go on the internet to learn about your health, right? Yeah. Any further questions? We're going to go over symptoms of heart attacks next. Okay. So men are more likely to have heart attacks than women. We've established that. Men also tend to have different symptoms than women. We had a cardiac ICU nurse in one of my classes, and I actually learned a lot from her experience. She said she usually only sees men in the ICU from heart attacks because women tend to not make it there in time. Any guesses why? So sometimes women can have such mild symptoms, they don't even know it's a heart attack, because I think everybody just kind of trusts what they see on TV, where it's like a dramatic chest pain that knocks you over, right? Most heart attacks start really slowly and with mild symptoms and gradually get worse. Pain can come and go. Pain can be severe or mild. And in some cases, women can get stomach upset and it's a heart attack. I don't want you guys to get paranoid from this, but I just want you to know it's possible, right? Nausea, dizziness, sweating, sometimes the pain's in the jaw, sometimes in the back. There was a woman in Eden, North Carolina, when I taught this class, and she shared her personal story where she thought she had indigestion, and her son happened to be home with her and said, I'm going to call 911, which he did, which is great. And she said, all I needed to do was burp. She said, I knew if I could just burp, I'd feel better, and it was a heart attack. And she just felt like she had gas that needed to come out. So I'm only saying this so that you can know in the back of your head to trust your instinct. And if you're ever, I know this is a great place to be if anything like this happens, but never be afraid to call 911. A lot of people think, oh, I don't feel like paying the bill. What if it's not a heart attack? Then they come for nothing. It does not cost anything for them to come and check you out. It's only a bill if you have to be transported somewhere. So remember that. Even if you're like, could it be? I don't know, not really sure. Just call. Just call and just be on the safe side. It never hurts, right? Anyone heard a story like that of a friend or family member that might have had a heart attack and didn't realize it was a heart attack? Nobody in this room. Well, okay, yeah. Yeah. So a lot of times they'll think it's a stomach problem. That's a really common one. And then women, of course, attribute it to old age or, post-menopause symptoms, things like that. So just kind of be aware just in case. Men, you seem to have more traditional symptoms. That doesn't mean you always will, right? So always remember that 911 just in case you need it. Any questions or anything you want to share? It's a quiet group today. Go ahead. I think you have a mic coming so that they can hear on the.
Do I have to sing?
You're being broadcast.
Okay. So when you talk about walking, and you'll know and shortness of breath, but you're also a personal trainer too, and I've used one in the past. So from a moderate heart rate, and I know it's 220 minus your age, but is it advisable to keep like within moderate being 70 to 75, or what would you consider a range for in the moderate based on the 220 minus the age?
Honestly, I don't use that anymore because everybody is so different. Like if somebody is really unconditioned, they're going to get super high super easily. So you have to be really careful. And some people have different resting heart rates. So, like, for example, 90 is a normal resting heart rate for some people. Others, 70 is a normal resting heart rate. So that calculation where their, heart rate zone should be is going to differ for those people, right?
Right.
Age is going to differ. If they're on a blood pressure medication, it will differ. If they have a heart issue or other medications that can control heart rate. So I always say the best is just to go by your exertion feeling.
And what about warm up and cool down? I mean, I see some people get out there and they zip around, and
Yeah.
I've got my 14 laps, and then they stop and they sit down. I mean,
Yeah.
I'm more of a believer in, slowly build up and slowly bring down,
Me too.
bring my heart rate down to below 100 and blood pressure. So, do you have a opinion on
100%.
that?
Yes, always warm up and always cool down, especially when you're doing cardiovascular exercise, because you don't want to, like you just said, raise your heart rate super fast, and you don't want it to drop super fast. Everything gradual, especially if you have heart issues or blood pressure issues. Great questions. Yeah. Anyone else? Go ahead.
Time do you, how much time do you normally spend on stretching?
As long as you want to. But I'd say you want to get good full body stretches maybe 3 to 4 days a week minimum. But stretching is very important. After exercise is the best time for static stretching. Does that make sense? Any other questions? Go ahead.
I know what the A1C is. I know what the A1C is, and I know your glucose uh, fasting level is. But there's another thing that I've read, and it's called spiking.
Mm.
And the only way to really understand spiking, and they say it could damage one of your endothelium tissues and stuff, and the only way to really test that is to do your blood sugar after you eat 1 hour, 2 hours, and
Mm-hmm.
three. I
Mm-hmm.
mean, many people think, oh, I'm not a diabetic
Yeah.
and their A1C is okay, but in fact, they still could be damaging
Mm-hmm.
their vascular system.
You're 100% correct. A1C is just an average over a 3-month period.
And that's where the information is lost. The averages don't show spiking.
No, they don't. Especially if somebody's not doesn't even have diabetes, they can still spike just under stress.
And it can still cause damage to your arteries.
Absolutely. Yeah. So honestly, the best way, if you're ever concerned about that, is to get one of those continuous glucose monitors. A lot of times doctors will do that if you suspect spikes, and that's the only way. Unless you're going to check your blood sugar several times a day, that's the only way to see the spike or the drop.
Well, not checking it after meal is besides the pressure of and the black and blue of the fingers pricking your
Yeah.
finger, but it is very accurate.
Yeah. Yeah. Great questions. And they are relevant because controlling diabetes has a lot to do with heart disease. Great questions. Anyone else have anything while I'm here? Jackie.
People out in TV land need to hear you.
Thank you. From your nutritional background too, sugar and white flour are bad. What do you replace white flour with?
Whole grains.
Whole grain flour, like whole wheat flour.
Or anything whole grains instead, like a whole grain pasta or
Oh,
are you talking about for baking?
yeah.
Yes, any type of whole grain flour, anything that's not white.
Thank you.
But if something has fiber, that's what's most important. If it's as close to nature as possible for the grain, that's what you want to be eating, not processed. Does that make sense?
Yeah, it does. Thank you.
You probably won't want to eat those cookies.
My question is, can you ask everybody in here what they would like to hear you speak about again? I know that you have like a huge repertoire of things you could talk about, so it might be good if we all said things we would like to hear.
Yeah, absolutely. Yeah. Are there any topics, health condition or otherwise, nutrition, lifestyle, that you guys would like to hear about next month? Go ahead. Oh, okay. Arthritis. Actually, I was thinking of doing arthritis next month because it's osteoporosis month and it kind of goes with it. And I'm already teaching it like 12 times, so it might make it easier just to keep it. Okay, awesome. Go ahead.
What about sugar substitutes? What do you think about those?
Had to ask that, didn't you? Okay, here's the thing. Chemicals you want to stay away from. So like the artificial sweeteners you want to stay away from. If we had to have a hierarchy of a natural 0-calorie sweetener, number one would be a monk fruit. There's very limited, and I stress the word limited, research saying that monk fruit can actually help your gut microflora balance. Very limited research. It's still being researched. Number 2 would be a stevia because that also comes from a plant. Chemical sweeteners, you want to definitely stay away from. First monk fruit, second stevia. If you have to have a 0-calorie sweetener. Yeah, I know that's the problem when you guys have to depend on a cafeteria. I know it's a little harder because you're not making your own food, but all we can do is our best, right? I always tell people you don't need to be you don't need to be A+ students, right? B+ is still great. It's what you do consistently that matters, not here and there, right? So just make those healthy choices as you can consistently. Know your numbers. Stay on top of your doctor's appointments. Keep up with your medications. And have conversations with your doctors. That's extremely important. And for those of you, I always run into people who want more time in the doctor's office. I just want to let you know there is a new primary care office in town called Centerwell. I don't know if you guys have heard of it yet. It's on the Graham side of Burlington. It used to be called Dedicated Medical Senior Center. But they have doctors that are value-based care doctors. Do you know what the difference is? So conventional medicine doctors tend to have about 3,000 patients to one doctor. And that's why they're kind of limited on time. They have to book, a volume of patients. Value-based doctors only have 300 patients to one doctor, so they tend to spend more time with their patients, and they're incentivized differently. They're not paid on volume. They're paid for keeping their patients out of the hospital, keeping them from getting sick, keeping them out of urgent care, so their whole incentive model is different. So just know one of those centers, it's owned by Humana, which is how I know about it. But if you ever want to take a tour at a Centerwell, there's one here in Burlington now, which we're really happy about. So keep that in mind. And then we also have, how many, just really quick, I'm curious, how many are Humana members in here? 3? Okay. So just know, I have a handout up here. If you guys like the internet or don't mind using it, there's a virtual neighborhood center online that's showing 4 health education classes a day right now, multiple topics, and you don't have to be a Humana member to log into it. And you can get the calendar, and you can also register with a health educator for a one-on-one. And you don't have to be a member for that either. So if you have like an individual condition you want to work with somebody on, nutrition, weight loss, anything like that, and you don't want to talk about it in front of a whole group, you can use that website to register for a one-on-one at no cost, even if you're not a member. Go ahead.
You just talking about the office up and around Graham,
Yes,
and you said we could do a tour?
absolutely.
Oh, I need to set one of those up,
Okay.
please.
I think Denny has, do you have the Centerwell flyer? Okay. We'll get that for you before I go.
Wonderful. That'd be awesome. Thank
Sure.
you.
Any other questions before I set you free? Go ahead. Okay, that's a great question. So the less processed, the better, right? So it's, again, kind of as close to nature thing again as possible. So like the maple syrup, the honey. But keep in mind, there's still sugar. So they'll still break down like sugar in your system. So if you're trying to avoid sugar, it's not better to have honey or maple syrup because it's going to break down the same. But it is less processed, which is a good thing. Does that make sense? Yeah, it is. Yeah, it's processed. Yeah. If you think about it, anything taken out of its natural form and made into something else and put in a box is processed, right? It's tough to avoid, right? But as the more you guys eat the real food, the better you'll be. Number 2 on that hierarchy of 0-calorie sweeteners, because it's from a plant, but still processed, like Pam said. Yeah. Go ahead. You're the star today.
Strange question, a strange topic, but we always talk about nutrition, what are you putting in, and et cetera. But what about optimizing your digestive system?
Mm,
That's, you could do all the right things you said,
yeah.
but if you're gulping it down and you're eating and you're not giving your system a chance to digest it and breaking down or overloading it,
Mm-hmm.
it's void of benefits. So you have a suggestion on optimizing? I'm
You-
laughing, but because it's not usually
Yeah.
optimizing your digestive system for the best health.
So it's funny you say that because I work with a local neurologist. You probably have heard of him, Dr. Shaw, right? He actually recently, and I just learned this for the first time from him, he said if you chew your food 20 times, it starts to send the signal to your brain that you're getting satiated. Whereas if you barely chew and you swallow, it takes a lot more of that for your stomach to tell your brain it's full. Oh. Right. No. Yeah, you're right. Yes. Yes. It's true. That my 17-year-old son is exactly what you just described, except for the wine or soda. But I'll look 5 minutes later, his plate's just completely empty. I didn't even see him eat it. I don't. No, that's the 21-year-old. Yeah. He's gained 50 pounds of muscle now in 2 years, staying lean. He grew up in a gym, though. Yes. His dad is currently still a trainer. Any other questions before I let you guys go? Awesome. All right, so I think we're going to do the arthritis class next month. Is that good with you guys? Okay. And if you need any other resources, we're going to get Centerwell. I don't know where he went. He might have gone to the. Okay, we'll get Centerwell to him. And you guys, if you need anything, just reach out to Michelle. If you forgot to ask a question or anything like that, she can get in touch with me. And I'll be back again next month. It's good to see you guys. Thank you. Thanks for coming out.